Navigating healthcare today can be a challenge for anyone. There are more choices than ever for patients and less personal interaction with just one doctor or healthcare provider. Oftentimes, patients are left confused or with many questions.
That's where RN4U comes in. Teresa Parker helps advocate for patients, and she has some ways you can help take control of your own medical journey. Hello and welcome to the show, Teresa. How are you doing today?
Doing well. Thank you for having me.
Yeah, we're glad you're here. Okay, you recommend that every patient take someone with them to every single doctor's appointment. Why is that?
Well, in today's healthcare, as you know, there's many different challenges. Less time is spent with the actual patient, more time documenting on the electronic record. It's a great idea to have a healthcare advocate, whether it be a family member, friend, neighbor, or a professional advocate there, just to serve as a second set of eyes and ears.
Mm-hmm.
When the FaceTime with doctors are very little, about just 7 minutes. So what do you recommend as someone goes to visit a doctor? What should they be doing, or how should they prepare?
To prepare, I would recommend that every patient make a list of questions and concerns and take a list of all their medications. They should make the list of concerns, make them in order of importance, so that if there's not enough time to go over everything, they actually can go over the most important ones. Because with 7 minutes of face-to-face time, that's very little time, as you know.
Mm-hmm. And the lists are so important. I think that we think we're going to remember everything, right? You go in and, oh, remember to ask about that.
Right.
But the truth is you don't. Also, having somebody there with you to take notes on what the doctor says and to get details about prescription medications is very helpful, particularly for seniors. Can you talk more about that, Teresa?
Correct, yes. Seniors, we all forget, but seniors in particular, as we age, we forget more. And once you get there in that doctor's office, a lot of people really get intimidated by healthcare professionals. So you get there and you forget what you're there for. So having someone there to actually take notes and ask questions to keep the conversation moving is very important. And actually, after the visit, it's also important that they can reinforce what happened during that visit and can relay the information to family members if a family member wasn't present. This actually prevents a lot of medication errors, a lot of problems with what the doctor said, say with increasing fluids or exercise. It's very important.
So when it comes to those errors that you're talking about that happens in hospital errors, how does healthcare advocate, how do they help this for the safety of the patient?
Well, medical errors in the hospital are increasing. Research shows that today there's between 250,000 and 400,000 in hospitals in the United States alone. And when you break that down, looking at the smallest number of 250,000, that's about 700 deaths per day.
Wow.
Wow, yes, that's a lot. And it's because of human nature. We all make errors. And it's also due to short staff and people being overworked. And so having an advocate there by your side, you can help in many ways. Anybody in the hospital is in a compromised situation. You don't go into the hospital because you're healthy. You go into the hospital because you're sick, you have an illness, or you're having surgery. And then on top of that, you're usually put on some mind-altering medications. So you're not in the best situation.
It's so true.
And you put on top of that, you have people coming in day and night disrupting your sleep pattern. You know, you have people coming in checking your vital signs, taking blood at 1 o'clock in the morning, and then doctors visiting at all hours of the day. So if you're under all this different types of stress, you really are not in your best mindset to listen to what's going on.
You're a private professional advocate.
Yes.
Talk a little bit briefly about what that means for patients and how you help them.
I am a nurse by my training, and a private patient advocate is someone who is hired to represent you as the patient. A patient can have an advocate. They can be anybody, a friend, a family member, a neighbor, but a private patient advocate is someone you hire to look out for your interests. I go with a patient to their appointments, to the hospital. I work with them in the home, so I am looking out for your interests only. And I can help you with anything that you ask me to related to health care.
It's a very valuable service. For more on what Teresa does or to contact her, check out her website. It's rn4u.com, rn4u.com. Teresa Parker, thank you very much.
Thank you for having me.
All right.